Hey there. So, in this video, I'll be talking about the arterial supply of the upper limb in brief. And in the subsequent videos, I'll be talking about each artery separately. So, this is like an overview of what you are dealing with. So, first artery that we are supposed to discuss here is axillary artery. The axillary artery is a direct continuation of subclavian artery. So, talking about its extent, it extends from the outer border of first rib to the lower border of teres major muscle. It is divided into three parts. By the pectoralis minor muscle. So if we talk about its appearance, the diagram would be something like this. So this is your axillary artery, this is your pectoralis minor, this is your teres major, and this would be your outer border of first rib. This is part 1, part 2, part 3. So part 1 has one branch, part 2 has 2 branches, and part 3 has 3 branches. So you can remember it as 1 1, 2 2, 3 3. So now talking about the parts of the axillary artery. So first part gives origin to the superior thoracic artery. The second part gives origin to the lateral thoracic artery. And the thoracoacromial artery. Thoracoacromial artery further gives A, P, C, D branches. So A is for acromial, P is for pectoral, C is for clavicular, and D is for deltoid branch. And you should remember that the thoracoacromial artery pierces the clavipectoral fascia. Clavipectoral fascia. This is important. It can be asked in MCQs. So after that, talking about the third part, it gives origin to your subscapular artery, which further gives origin to the circumflex scapular artery. See, at your level, even remembering the names is enough. You don't really need to remember the course of the branches. You just need to remember the course and relations of the axillary artery, which I will discuss in the next video. So it also gives origin to the anterior circumflexhumeral artery. And you should always learn arteries in abbreviations, because mostly when you see some CT scan or some MRI, then or some angiogram, it will always be written like this. And after that, posterior circumflexhumeral artery. So with this, we have completed the branches of the axillary artery. And now it is important to remember that there is an important anastomosis around the scapula. I hope you know about scapula and its attachments, because it is an important question as well. I'll be using a rough diagram of scapula here. So this is your scapula, this is your suprascapular foramen, just a second. This is your suprascapular foramen, and okay, so we have basically uh, the anastomosis around three parts of scapula. One is the inferior angle, second is the body, and third is the lateral angle. So one is your inferior angle, second is your body, and third is your. So one is around the inferior angle of the scapula, second is around the body of scapula, and third is around the acromion process of scapula. So talking about the arteries that will be participating in this anastomosis. So the first artery that we will see here is the dorsal scapular artery. Then the second one will be subscapular artery. And coming from the suprascapular foramen will be your suprascapular artery, then the circumflex humeral artery, and the circumflex scapular artery, and then the posterior circumflex humeral artery, which will be coming from here. Okay, so now let's talk about the anastomosis. So first we will talk at the inferior angle of the scapula. So one is your subscapular artery. You have heard of this name before. You just heard it. It is the branch of third part of axillary artery. And the second one is your dorsal scapular artery. You might not have heard of this name before because I never taught you about it. It is the branch of third part of subclavian artery. Okay. So now with this, we'll be talking about the anastomosis around the body of scapula. So this is a major site of anastomosis. The inferior angle is also a major site of anastomosis. So around the body of scapula, basically three arteries participate. One is the dorsal scapular artery, yes, branch of third part of subclavian artery, and the second one is suprascapular artery. Now it is important to discuss here that it is a branch of thyrocervical trunk. So I'll discuss an important mnemonic here about the branches of thyrocervical trunk. So remember SIT, SIT. So SIT would be basically first, S would stand for suprascapular artery. Second would stand for inferior thyroid artery. And the transverse cervical artery. Okay, so three arteries participate in the anastomosis around the body of scapula. One is dorsal scapular artery, suprascapular artery, and the circumflex scapular artery. Yes, it is a branch of subscapular artery. Okay, now we'll be talking about the anastomosis around the acromion process of the scapula. It is a minor site. Three arteries: suprascapular artery, posterior circumflex humeral artery, acromial branch of thoracoacromial artery. You can now see the diagram here. So I taught you that this is your dorsal scapular artery. This is your subscapular artery. This is your circumflex scapular artery. This is your posterior circumflex humeral artery. This is your suprascapular artery. Okay, so now see here. First of all, talking about the inferior angle of the scapula. So in inferior angle, you can easily see that subscapular artery and dorsal scapular artery are anastomosing. And around the body of scapula, the dorsal scapular artery, just a second, dorsal scapular artery, dorsal scapular artery, suprascapular artery, and circumflex scapular artery. Dorsal scapular artery, suprascapular artery, and circumflex scapular artery. So you can see they are anastomosing around the body of scapula. So now talking about the acromion process. In the acromion process, I told you that suprascapular artery, posterior circumflex humeral artery, and the acromial branch of thoracoacromial artery. Let me just show it here. So the acromial branch of thoracoacromial artery. This is suprascapular. So these will be anastomosing here. It is important for you to remember this anastomosis. Basically, you have to remember two anastomosis in the arterial supply of upper limb. One is around the scapula and another one is around the elbow joint. I'll be teaching you that in another video. Okay, so now axillary artery is done and we are talking about the brachial artery. So it is important to know here that brachial artery is the continuation of axillary artery. Continuation of axillary artery. From where? Remember I told you about the extent of axillary artery. It ended on the lower border of teres major muscle. So now the brachial artery will begin from the lower border of teres major muscle. And talking about its bifurcation at the level of neck of radius. Brachial artery divides into radial artery and ulnar artery. See, in this video I'll be talking about I have started from the shoulder and I'll be going towards the tip of the finger. I'll be teaching you about all the arteries including the blood supply of palm, which is very important in 5 marker. It can be asked as a 5 marker in university exams. So I'm talking about the branches of brachial artery. So first branch is your profunda brachiae artery, which is the largest branch of the brachial artery, profunda brachiae artery. This in turn gives radial collateral artery. So now the second branch is your superior ulnar collateral artery. Now you have to remember these branches because when I will discuss the anastomosis around elbow joint, then I will be using these terminologies and you will have to remember them. These names I will be using when I will teach them. So the third one is inferior ulnar collateral artery. So at the level of the neck of radius, the brachial artery will be split into the radial artery and the ulnar artery. So now talking about the branches of the ulnar artery, it will give a common interosseous artery. This common interosseous artery will further divide into anterior interosseous artery and posterior interosseous artery. This posterior interosseous artery will further give you interosseous recurrent artery. Don't worry, I will be discussing these arteries when I will be teaching about the anastomosis around elbow joint. So it is important to discuss about Volkmann's ischemic contracture here. If you have studied humerus bone in detail from chapter 2nd of BDC, you would know about this already. But nevertheless, it is important to discuss about it here. So, whenever there is a supracondylar fracture of humerus, this is the condyle of humerus. So, whenever there is a fracture here, so this fracture will basically cause the laceration or occlusion of brachial artery. Okay, so I will be talking some pathology here. So when there is laceration or occlusion of brachial artery, there would be cessation of blood supply. So cessation of blood supply is also known as ischemia. Ischemia always leads to necrosis. So this will cause ischemic necrosis of the flexure muscles of the hand, causing a characteristic flexed hand. And when we are talking which nerve is damaged, now this is a controversial question because in Gray's anatomy it is given that anterior interosseous nerve is damaged in supracondylar fractures of humerus, but in BDC and in Vishram Singh it is given that median nerve is affected. So now what are you supposed to follow? If it is asked in your next exam, you will prefer anterior interosseous artery more than median nerve. This has been asked in NEET 2017. Okay. So now I talked about the ulnar artery. I talked about the brachial artery. Now I will tell you about the palmar arches and then go on discussing about the anastomosis around the elbow joint. Okay. So ulnar artery forms superficial palmar arch. Radial artery forms deep palmar arch. Now what are you supposed to know here? You are supposed to remember that the deep palmar arch is 1 centimeter proximal to superficial palmar arch. I'll be discussing these arches after I'm done with this. So let's suppose this is our hand. Sorry, my drawing is not that good. So this is your okay, and then we will discuss this. Okay, so this is your superficial arch. This is your deep arch. As you can see, the deep arch is 1 centimeter proximal to the superficial arch. Okay. Now, see, remember this thing. The blood supply and nerve supply of hand are very important in anatomy. So the radial artery supplies lateral 1.5 of the hand, and there are two branches involved in this. One is your princeps pollicis. Pollicis always indicates thumb. Remember that while studying hand. And other one is your radialis indicis artery. Indicis indicates index finger. So this is your index finger and this is your thumb. I hope you know that. So this is the principal artery, P for P, principal artery supplying both radial and ulnar aspect of thumb. I hope you are taking notes along with the video, because it is very important to take notes. If you don't take notes, this is very volatile. You will forget about it in no time. Okay, so now we are going to discuss about the superficial palmar arch. So superficial palmar arch is a continuation of ulnar artery. I just discussed about that. And it completes on radial side, lateral side, by contribution from radial artery. Okay, and the superficial palmar arch supplies medial 3.5 digits. So now talking about the arch in particular, the superficial palmar arch. So it has one proper branch and 3 common branches. The proper branch will supply the ulnar aspect of the little finger. So now I will show you the diagram of your superficial arch. Okay, so this is your common branch. Okay, this is your so this is your superficial arch, and now this would be your one common branch, second common branch, third common branch, and a proper branch. Okay, so now talking about this is your, these 3 are your common branches. So these go here and then terminate in, so these go here and then terminate into 2 proper branches. See, common branch, proper branch, common branch, proper branch. So okay, this is not a proper branch, but yeah, the common branches further bifurcate and supply these aspects of hand. Only this is a proper branch. Okay, so this is your proper branch, proper palmar branch. These are your common branches. 1, 2, 3. Okay, so this is your superficial palmar branch. It supplies the lateral 1, 2, 3.5. So it supplies the medial 3.5 of your palm. Okay, so now I'll be talking about the deep palmar arch. So this is our hand as usual. Okay, and this is your deep palmar arch. So first we have princeps pollicis, then we have our radialis indicis. Princeps pollicis, radialis indicis. Okay, So this is your deep palmar arch. Now I'll be discussing about the anastomosis around the elbow joint. So in the elbow, first of all, you need to know that whenever there is an anastomosis, we are linking arteries there. In this case, we are linking brachial, radial, and the ulnar artery. So humerus has two condyles, the medial condyle, the lateral condyle. So your medial condyle. Okay. So now we'll be talking about the anastomosis in particular. Okay. So this is a medial condyle. Now uh, so let's talk the lateral condyle first. So in front of the lateral condyle, that is anterior to the lateral condyle, an artery will be descending. That artery is the radial collateral branch of profunda brachia. Radial collateral branch. So now this radial collateral branch of the profunda brachia will anastomose with the with your radial recurrent branch of radial artery. Radial recurrent branch. So this is your first anastomosis. Now behind, that is posterior to the lateral condyle, an artery will be descending. This artery is your middle collateral branch of the profunda brachia, and this will anastomose with the introitious recurrent branch of posterior introitious artery. Introitious recurrent branch of posterior introitious artery. I told you about it while we were discussing. So now in front of the medial condyle, in front of, that is anterior to the medial epicondyle of humerus, the inferior collateral branch, of ulnar artery will anastomose with the anterior ulnar recurrent branch. Anterior ulnar recurrent branch of ulnar artery, and behind, that is posteriorly to the medial epicondyle of the humerus, the superior ulnar collateral branch of the brachial artery anastomoses with the posterior ulnar recurrent branch. Posterior ulnar recurrent branch. Okay, so this completes your anastomosis around the elbow joint. Now I have a flow chart prepared for you. See, first of all we had subclavian artery. The third part of subclavian artery gives origin to the dorsal scapular artery. Okay, so subclavian artery from the outer border of first rib to the lower border of teres major is known as axillary artery. Okay, axillary artery is divided into three parts by pectoralis minor muscle. First part gives one branch named superior thoracic artery. Second branch gives two branches named the lateral thoracic artery and the thoracoacromial artery, which further give APCD branches: acromial, pectoral, clavicular, deltoid. Third part gives three branches: subscapular artery, which further gives circumflex scapular artery, which I hope you remember participates in the anastomosis around scapula, and it also gives the anterior circumflex humeral artery and posterior circumflex humeral artery. Now, the axillary artery from the lower border of teres major continues as brachial artery. Brachial artery gives three branches: profunda brachii artery, superior ulnar collateral artery, and inferior ulnar collateral artery. The profunda brachii artery gives the radial collateral artery and the middle collateral artery. At the neck of radius, the brachial artery divides into two arteries: radial artery and ulnar artery. Ulnar artery gives common introitious artery. Common introitious artery further gives anterior introitious artery and posterior introitious artery. Posterior introitious artery further gives introitious recurrent artery, and your ulnar artery continues at the superficial palmar arch, which supplies the medial 3.5 digits of your, and the radial artery continues at the deep palmar arch, which is 1 centimeter proximal to the superficial palmar arch and supplies lateral 1.5 by two arteries: princeps pollicis and your radialis and diasis. And the other two important questions are anastomosis around scapula, anastomosis around the elbow joint. Now, before the exam, all you have to do is look at this flowchart while revising the upper limb. Just look at this flowchart. Remember all the arteries. Remember how the arches are made. Remember which arteries participate in the anastomosis around scapula. Remember which arteries participate in the anastomosis around the elbow joint. And you have a gross idea of the blood supply of the upper limb. In the next videos, I will be discussing two important questions, that is axillary artery and the brachial artery. I'll be discussing their branches. I'll be discussing their course. I'll be discussing their extent. So stay tuned for more videos. Thank you. Thanks for watching.